Hello and welcome to episode 86 of the Pet Behavior Chat. And in today's episode, I thought we would chat a little bit about behavior signs and neurotransmitters. And I think there are a couple of reasons I wanted to talk about this. The first one being medication choices. I think sometimes it can be really difficult to know which behavior medication to choose, to know where to start. Like, am I even in the right ballpark? Is this a good choice? And oftentimes, I think we kind of stab in the dark a little bit, or maybe it's a medication that we're used to, or that many of our colleagues are prescribing, or that is just, sort of the known medication maybe for behavior. And sometimes we're not actually being led by the behavior signs. And behavior signs in the veterinary behavior world essentially are our symptoms, if you like. So whereby in a medical case, we might be looking at diarrhea, vomiting, all those sorts of things. From a behavioral point of view, it's actually the behaviors and the behavior signs that we're looking at. And it's the behavior signs that give us an indication as to what neurotransmitter systems might be affected. And then once we know what neurotransmitter systems are affected, can we go on to make informed medication choices without feeling like we're kind of stabbing in the dark and just choosing something because we don't really know what else to choose? So I thought we would chat a little bit through that today. The other thing that I wanted to also talk about is that behavior is a result of brain processes. And we know that behavior is pretty complex. There's so much that kind of feeds into that, whether that's environment, whether it's learning, whether it's physical health. There are so many factors that kind of fall into that. But at the end of the day, we need to remember that behavior, and especially perhaps some of the behavior signs that we want to treat or that we maybe don't like seeing, such as fear, anxiety, stress, compulsive behaviors, aggressive behaviors, that they are essentially the result of brain processes. And those brain processes also involve neurotransmitters. And so that's why I think it's really important to just have a bit of an understanding as to what behavior signs correlate with what neurotransmitters. And when we know that, as I mentioned, it gives us a much, much better way of choosing behavior medications rather than kind of just perhaps according to a diagnosis, or this is the right behavior medication for separation anxiety, or, and so on and so forth. So let's really dive deep into these neurotransmitters. So the first neurotransmitter, and we're going to kind of come at this from two different directions. So we're going to have a look at the behavior signs and see what neurotransmitters might be correlated with them. And then we're going to have a look at the neurotransmitters and see what behavioral signs they're responsible for. So let's get started with our monoamine neurotransmitters. So first of all, what are monoamine neurotransmitters? Well, we're talking about serotonin, dopamine, and noradrenaline. They're the three big ones. They're the three sort of most common ones, I guess, that we think about when it comes to treating behavioral presentations. And when we think about some of the behavioral signs that we could be seeing in our patients, then some of those are correlated with those neurotransmitters. And another thing that we need to think about is, well, if we have said behavioral sign, do we think that those neurotransmitter levels are too high, or do we think they're too low? So do we think we need to be increasing that neurotransmitter with the help of our medication, or do we think that we need to be decreasing that neurotransmitter with the help of our medication? And so let's go through a couple of behavioral signs. Now, the first one I'm going to talk about is fear and anxiety, because that's something that we see really commonly. And if we think about our monoamine neurotransmitters, there we would definitely be thinking about serotonin levels being too low and potentially noradrenaline levels being too high. What about aggressive behaviors? Now, again, we have to be really careful. So aggression per se isn't a diagnosis. However, aggressive behaviors do fall under behavioral signs. So what do we think about aggression? Well, for aggressive behaviors, again, we think serotonin levels are likely too low in many cases. And again, we think that probably noradrenaline levels are too high. Now, what about compulsive behaviors, abnormal repetitive behaviors? Well, there we're thinking about potentially higher levels of dopamine and also lower levels of serotonin. What else have we got? What about arousal and irritability? So again, when we're thinking about the monoamine neurotransmitters, we're thinking about high levels of noradrenaline. The same goes for hypervigilance, hyperattentiveness, probably high levels of noradrenaline. Impulsivity, explosivity, probably low levels of serotonin, and probably also high levels of noradrenaline. Mood, so we're thinking potentially low levels of serotonin, if we've got kind of low mood in general, low levels of serotonin, and maybe also low levels of dopamine, and maybe also low levels of noradrenaline. So that's a little bit what we're thinking about when we're thinking of our monoamine neurotransmitters. Now, we have another group of neurotransmitters that we want to think about, and that is GABA and glutamate. So GABA and glutamate are kind of our yin and yang, if you like, in the brain. So GABA would be our calming neurotransmitter, and glutamate would be our excitatory, fiery neurotransmitter. And again, when we think about these two neurotransmitters and we think about behavioral signs, we can also start to think about what levels might be too high or low. So again, if we start with fear and anxiety, probably high levels of glutamate, probably low levels of GABA. What about aggressive behaviors? Probably also high levels of glutamate here. What about, again, impulsivity, explosivity, high glutamate, arousal, irritability, high glutamate, hyperattentiveness, hypervigilance, high glutamate. So you can start to see a pattern here. Some of these like more explosive behaviors, more maybe in inverted commas, reactive behaviors can be associated with high levels of glutamate. So when we make our medication choices, we might be thinking of wanting to lower those. What about GABA? So I think I mentioned, fear and anxiety is definitely where we think about having low GABA levels. So we always want to be thinking about increasing GABA, the neurotransmitter GABA, when we're dealing with fear and anxiety. So that's a little bit if we're looking at kind of behavioral signs and then looking at what neurotransmitters they might be affecting. Now, you can look at this the other way around as well. So if we're thinking about the neurotransmitters, what they're responsible for example, so we can go again, start with the monoamines. So if we're thinking about dopamine, we know this, pleasure, drive, reward. So adequate or appropriate dopamine levels are going to be responsible for appropriate levels of all of these things, pleasure, drive, and reward. Now, if dopamine is too high, again, we have perhaps these abnormal repetitive behaviors. If dopamine is too low, we might have lack of motivation, lack of attention, maybe not willing to learn or engage in training exercises, maybe not as alert or attentive. So all of those things can be associated with dopamine. What about serotonin? So serotonin, I think we already spoke about a little bit. So anxiety, fears, we probably have low serotonin levels. Aggression, we also probably have low serotonin levels. And then things such as mood and cognition and appetite and also abnormal repetitive behaviors can also be affected by serotonin. So for the abnormal repetitive behaviors, we probably have low serotonin levels here. So again, thinking about what does each individual neurotransmitter do and what are the signs that either too high or too low levels might cause. Noradrenaline, we spoke about this a little bit in the previous section. So noradrenaline is responsible for vigilance, concentration, arousal. So if we have high noradrenaline levels, we've probably got hypervigilance, hyperarousal, hyperattention, hyperalertness. So again, you start to see sort of some of the patterns here amongst the different neurotransmitters. And then again, speaking about GABA and glutamate, so we know that glutamate is our fiery one. So it's our main excitatory neurotransmitter. Glutamate is also epileptogenic. So if we have high levels of glutamate, that can also cause seizure activity. It's probably the most widespread neurotransmitter in the brain. So it has really wide reaching effects. And again, when we think about high levels of glutamate, we're thinking about vigilance, impulsivity, arousal, potentially anxiety, maybe muscle tension. Pain is another one that's associated with glutamate. So if we've got any of these signs, we're wanting to choose medications that are targeting these neurotransmitters. And then GABA is our calming neurotransmitter. So it's our inhibitory neurotransmitter, sometimes also called the mediator of excitation. So it mediates, reduces the excitatory signals. And again, GABA and glutamate are kind of the yin and the yang. So GABA would be our yin and glutamate would be our yang. And so when we're thinking about GABA, we're always thinking about, if we increase GABA, we're hoping to get more calm behaviors, less fear, less anxiety, less stress, perhaps better cognition if we're increasing GABA. So that kind of chats you through a little bit our 5 main neurotransmitters and the behavioral signs that are associated with them. And again, the reason why I feel it's so important is when we're making those medication choices, and even when we're thinking about diagnosis. So when we have a behavior patients that is presented to us, we want to try and understand what are their main behavioral signs. What are the signs that they're showing? Is it perhaps a dog that's very hyper-aroused, very hypertensive, very hyper-alert, can't focus, can't concentrate because they're so hyper-aroused? Do they fall into that category? Or are they the dog that's perhaps more withdrawn, with perhaps lower mood, perhaps a little bit of anhedonia, so no real pleasure, not wanting to seek social interactions? So those can be quite different presentations, and the choices of medication are going to be different according to the presentation that we have. Similarly, in cats, we can get similar sort of presentations. We can get those cats that are very hyper aroused, that are perhaps frustrated. If we're thinking about an intercat aggression case, those can be the cats that are kind of the aggressors. So what are the medications that we might choose to target that? Whereas on the other side, we might have maybe the victim cat in an intercat aggression scenario that is more fearful, anxious, shy, hiding, and we might want to be targeting different neurotransmitter systems in that instance. So really, really important to kind of have an understanding of that. Now, you could say to me, what happens if I've got multiple signs? What happens if I've got, lots of different behavioral signs going on, which absolutely can be the case. And many of the patients that I see have a lot of different signs going on, and they have a lot of different diagnoses as well. And I think one of the things two things that I often think about is, number one, I ask the caregiver, what is the sign that you most want to see change? So it could be that maybe the owner's less concerned maybe about the dog's fear, anxiety, but is very, very concerned about their hyperarousal, their explosivity. That might come with unpredictability, difficulty to handle and manage. So that might then be the first thing I tackle. Whereas I have other caregivers that are absolutely distraught by how anxious their dog is, how fearful they are, how much sort of panic, true panic and fear, maybe even phobias they're experiencing. And they're maybe not quite as concerned about the dog having shown reactive behaviors towards children, for example, in the past, because they know that they don't really encounter a lot of children in their lives. But this fear and anxiety is something that's massively affecting the dog's quality of life and their quality of life. So I might then be choosing to target that sign first. Sometimes I'm also led by the sign that I think is going to be probably the most important to treat. And my main example for that is if I have an animal if I have a patient that is showing a number of different signs, but one of those is an abnormal repetitive behavior. Let's say, for example, we've got a cat that's very hyper aroused, that maybe is showing human directed aggressive behaviors, but at the same time is also showing pica. So ingestion of, let's say, rubber items, for example, and may even have had a foreign body surgery before in the past. And I've ruled out that it's not something gastrointestinal, that we don't have underlying gastrointestinal disease, but we feel that this is a true sort of abnormal repetitive behavior. Then I would probably be addressing that sign first and foremost. I think, when I make my medication choices, I might try and choose a medication that targets a number of those things together, but I'm probably, when I'm choosing my medication and when I'm choosing my dose range, I'm going to be led by that abnormal repetitive behavior in most instances. So that's a little bit about behavioral behavioral science and neurotransmitters. Now, I do have a really lovely handout, free PDF handout for you that I'm going to put into the show notes, which gives you a table of behavior signs and which neurotransmitters we think are high, which ones we think are low. So please go ahead and download that. It's a really handy one to have by your side. I literally always have that with me. And if I'm not quite sure about something, I'll refer back to it and I'll see if I can group the signs together in a neurotransmitter class and make my medication choices according to that. And then, of course, this is a topic I dive massively into in my psychoactive course. So my psychoactive course is a self-paced online course which dives deep into veterinary psychopharmacology. I've kind of called it practical veterinary psychopharmacology because that's exactly what I was intending. So when I finished studying for my board exams, I had all this psychopharmacology knowledge fresh in my mind, and I wanted to make sure that I packaged it before I lost a lot of it. Sort of study related knowledge. I packaged it in a course, but that course was really relevant for general practitioners working in practice to start understanding some of the basics and some of the thought processes that I and other veterinary behaviorists go through when we're choosing medications. It has been an absolute hit. Psychoactive has been extremely popular. I have also a whole number of veterinary behavior residents within the course. So the information is detailed enough to be relevant to experienced behavior practitioners, but is also, I guess, foundational enough if you're just starting out on your veterinary psychopharmacology journey that you're going to get so much from this course. So I'm also going to put the link to the psychoactive course in the show notes. And during the summer of 2025, which is when I'm recording this podcast, there is a 50% discount on psychoactive. And I will put the discount code again in the show notes, but it's basically summer 50. So summer all in caps 50. And yeah, so if you're interested in learning more and learning about some of these, sort of, I guess, subtleties and these sort of little tidbits and practical pieces that are going to help you choose your behavior medications, then psychoactive absolutely is the course for you. So that's the free PDF download, and that is psychoactive. I really hope that you have enjoyed this episode, and I very much look forward to seeing you in the next one. Bye for now.